Welcome back. In this video we're going to look at an application for runner's knee or jumper's knee, also known as patellar tendinopathy, or in later stages chondromalacia patella. So it's generally that inflammation, degeneration, overuse of the patellar tendon or quadriceps tendon. Lots of causes, but a simple application can give quite a bit of relief. You might have seen some people, there's a condition called Osgood-Schlatter's where it develops in adolescence, and they do use a band or a tubing across that patellar tendon at the knee. So that's also used sometimes for patellar tendinopathy, and can be used in this situation, or this application can provide a similar technique. So what I've done is cut a 25 centimeter eye strip, and we're going to tear the paper backing in the center for this strip. So we're going to apply it horizontally or roughly horizontally across that patellar tendon underneath that kneecap, and direct it up toward the hamstrings. So ideally with this one, be seated or on the couch. Find somewhere where you can have that knee up, or the ankle up, sorry, and that knee slightly bent on something. So you could sit on the couch and have a pillow underneath, but we want that knee on a bit of a bend to start. If we apply the tape with a straight knee and direct it to the hamstrings, then when we bend the knee through movement, we're going to get the tape peeling off. And if we have the knee too bent, when we stand up and straighten the knee, then that's also going to peel from underneath. So ideally, we want that knee roughly sort of 30-40 degrees. So having a pillow underneath gives a good rough angle that we want to start with. So once we've got that eye strip, 25 centimeters, tearing the paper backing straight across at the center, and peel the paper backing away so that you expose a center strip of the adhesive surface. And then what you want to do is, between your index finger and middle finger, having the middle finger facing on the other side. So you've got your index finger on the side that's closest to you with both hands. So all of my fingers except my index are facing away from me, and then my index finger and thumb are on the adhesive side of the tape. Sorry, on the other side of the tape. So that way when I apply tension, I'm getting an even stretch. If we apply with just a pinch, then we're going to get uneven stretch through that tape. So index and middle fingers clamping down over the tape to get even tension. So we want to apply 75 to full tension through the tape, knee 30 to 40 degrees, and we're going to apply that directly underneath the kneecap, pulling up slightly. So you can see there's an angle pulling up towards me, so we're almost scooping that patella or kneecap and scooping it up slightly. Once we've got that tension down and applied to the skin, we can hold that. So we should just have those ends, and then I can apply the last sections of tape, so the last inch or two or last several centimeters up toward the hamstring. So you're kind of going up diagonally to the back of the thigh, and then the same with the inside strip. So just to show the inside one, running up toward the hamstring. So it can be a longer strip, doesn't have to be, but we need to scoop that patella up and direct the tape up and backwards. So that way when I straighten the knee, it's pulling that patella up a little bit. When I bend the knee, the tape's just below straight. So that way we're not having the tape too far down where it's going to peel from the top, and we're not having the tape pulling too far up that it will peel from the bottom when we stretch the knee out into extension. So give that tape a good rub. And then when you stand up, we should have that nice scooping action with that tape pulling that patella upwards. And that should still allow a full range of motion. So that's the application for patellar tendinopathy, runner's knee or jumper's knee.